What is chronic migraine? It's headaches that occur more often than not. And many of these headaches are severe and disabling. It's frequently complicated by the overuse of triptans or opioids or nonsteroidals. And frequently the patients become depressed, not because they're depressed and have a headache, because a headache gives them a depression. So there has to be a holistic approach to the patient. Associated features need to be considered. Comorbid illnesses like depression need to be considered. And my basic philosophy is start somebody on a preventative medicine. Don't worry about detoxifying immediately unless they're taking large amounts of medicines that could be harmful to them, and then later detoxify them. And I think those are the basic principles. And with some of our newer drugs, biologics like botulinum toxin or the CGRP antibodies, many of us are now going to give prevention first, detox later.
The development of new acute therapies has really had dual goals. One, maintain efficacy that we've seen in the triptan era, and two, evolve safer and better tolerated acute therapies. And I think that it's fair to say that both the ditans, lasmiditan, and the Gepants from Agepant and Ubrogepant have met that message. They've been able to develop they've been able to develop in a way that has where the efficacy is maintained, the pain-free rates are quite reasonable, and they're better tolerated and clearly going to be safer because they don't have the baggage of vasoconstriction. For preventive therapies, what we've wanted are two things. We've wanted a migraine preventive. We've not had that until these monoclonal antibodies came along. So we now have something that does what it says on the jar, a migraine drug that treats migraine. And almost for a bonus, it's extremely well tolerated. These monoclonal antibodies have no really bothersome side effects. So that instead of patients having to have the trade-off between their attacks, reducing their attacks with a preventive but picking up some side effects, we don't have to have that discussion anymore. I think it's the thing that patients have really been, and certainly physicians have really been looking for over a long period of time.
Migraine treatment includes preventive medicines that are used to decrease the frequency of headache even in the absence of an attack, and acute medicines that are taken when the attack occurs to relieve pain and restore ability to function, and also to relieve the associated symptoms of migraine like nausea, sensitivity to light, and sensitivity to sound. In the 90s, the big step forward in migraine acute treatment was the triptans, and certainly now that class of medication is the most widely used acute treatment for migraine. There are currently 3 new acute medications for migraine in development. 2 of them work by blocking the receptor for CGRP, a molecule well known to be involved in the pathophysiology of migraine. One of them works as a 5-HT1F agonist, and all 3 drugs have 2 important things in common. The first is that they're not triptans, so they may well be effective options for the people who don't get the treatment response they need from triptans. And the second important aspect of the CGRP and 5-HT1F targeted therapies is that they seem to be completely free of the cardiovascular liability that plagues the triptans. So people who've had heart attack, stroke, angina, claudication, ischemic colitis, or people who have a lot of cardiovascular risk factors are not good candidates for triptans, and treating those patients has been a real problem. So there's emerging evidence that in people who don't respond to triptans and in people who can't take them, they're much more likely to get opioids as pain relievers. And we know that opioids relieve migraine on a short-term basis, but make it worse on a long-term basis, Part of the reason why these new classes of medication are exciting is because they'll give us something to offer in people who don't respond to triptans, but also, and perhaps more importantly, something we can give to patients in whom prescribing triptans is not appropriate.